Hello everyone, it is Dr. Locklear here, and I'm coming to you today with the concept of safety, which is Module 51 in the second edition or second volume of your Pearson text, and it begins on page 2871. And as nurses, we should think safety, safety, safety. And today in this lecture, we are going to talk about something called QSIN. And I don't want you to forget what that is, okay? So what does safety mean? Seek safety, aim safety, follow safety rules, ensure safety, teach safety, and yield safety. In other words, be safe. You don't want to be the next person that they're reading about in the news, or because you've had an error, and you caused it to take someone's life. We need to be extremely careful. We work in a legal binding profession, and you need to always have that on your mind. So we want to analyze the attributes of safety, differentiate common alterations of safety, summarize the relationship between safety and other concepts, explain the promotion of health safety, differentiate common assessment data used to examine safety, explain independent interventions that can be implemented for the patient's safety, and again, our goal is to keep the patient safe. We want to keep ourselves safe, but we need to keep the patient and their family members and everyone who's within the facility safe. And we want to summarize collaborative efforts used by the interprofessional teams and patients for safety in healthcare settings. So what is the concept of safety? When quality and safety are not priorities in healthcare, safety records reflect increases in accidents, errors, medication errors, injuries and infections. And infections and med errors and things like that and injuries will kill your patient. Statistics about patients in healthcare settings reflect that every year 1 of 25 patients acquire a healthcare associated infection. A patient on Medicare has a 1 in 4 chance of experiencing harm, injury, or death when admitted to the hospital, because most people who are on Medicare are older people. And every day more than 1,000 patients will die as a result of preventable harm or adverse events. A lot of what happens can be prevented. Do your safety checks. Take your time. Even if you have to have a little speed to what you're doing, but don't do it in a rush. Is safety limited to patients, or does it also include the healthcare workforce? Of course it does. It is a safety issue when the patient is left in a tightly tied wrist restraint throughout the night shift and no one checks, and then the patient has tingling and numbness below the restraint. We've cut off their blood supply. But what about the patient with congestive heart failure who's on a salt-free diet but who's been given packs of salt from the staff? That is preventable. You should know what kind of diet they're on and adhere to that diet and educate them about the diet. Don't accidents happen sometimes, as in the example of an elderly patient who was told not to get out of bed without help, but who does, then trips over a towel left on the floor and falls? We need to make sure, and I'm a stickler about this, patients' rooms should be kept neat and clean. It is our job, not just the nursing assistant or housekeeping, to make sure that there's not linen on the floor, that we're not throwing linen on the floor. The room is arranged in a way that the patient can get up and go to the bathroom without falling. I tell you, one of my pet peeves, and whoever's in clinical with me, you are going to see this, I want those rooms clean. Keep the overbed tables clean. It cuts down on infection. This is their living environment, and we need to make sure that it is as feasible as possible. Because if a patient does get up and fall, they could get a hip fracture, which leads to longer health stays, and it is much more costly. The nurse who's in a hurry who forgets to perform hand hygiene after changing a patient's IV dressing and then moves on to the next patient who needs a Foley catheter. What about chemical exposure, attacks of violence, needle sticks, musculoskeletal injuries? Who is responsible to be alert for safety hazards? We are. We have to make sure that we're safe and that we're trying to avoid errors and infections and stop accidents. Are they all from faulty systems or conditions, or are people a big part of the problem? What do you think? Things that are preventable, then it's our fault. We could have prevented that if we would have followed the rules. And that's what we have to do. So again, we need to make sure that we're being safe, that we're following, the rules, that we're doing med pass in an appropriate way. The rooms are neat and clean. I will say this till I nurse no more, and I've said it for the last 40 years. You cannot nurse from the desk. Yes, there's times that you got to go chart, but your job is to be down those hallways checking on your patients in your patients' rooms most of your shift. And I can't stress that enough, because if you're not down checking on your patients, you don't know what's going on with them. Attributes of safety. So unsafe situations can occur in all settings. Safety refers to the decreasing risk of dangers or hazards to prevent accidents, injuries, mistakes, and harm. Quality relates to the level of performance consistent with current evidence that increases efficiency and effectiveness for desired outcomes. And this is from your Agency for Healthcare Research and Quality, which is called the AHRQ. That is a resource that I refer to quite often. It requires everyone in healthcare facilities to engage in safe behaviors, be aware of your surroundings to protect against unsafe situations and prevent safety hazards. And that is our job, is to prevent safety hazards and to provide safe quality care. I mentioned the word QSIN, and you're going to hear that again when we get to patient safety and 51B. QSIN is Quality Safety Education of Nurses, and it's put out by the American Nurses Association. And we need to constantly think about that. Am I providing quality, safe care? Am I a nurse that's been educated properly? Look at the attributes of safety. These are the qualities or properties of remaining safe. They are the precautions. We have to take precautions when we're providing care. Some of the examples are listed below. You have 1 through 12. Schedule hazard surveys and safety health inspections in all areas. Implement effective hazard reporting systems available to all employees. You have to report when something happens. And just because you report it and you admit your guilt still doesn't mean that you're not going to have to face the repercussions of what you've done. But you should admit your guilt and let it be known what happened. Investigate all safety incidents for root cause. And so you do a root cause analysis. What was the root cause? What caused it? Perform job hazard analysis for all departments. Keep safety, health rules, work practices readily available. Where are your policy and procedures? Do you know where to find them? Do you ever look at them? You should. If you don't know what to do, you should pull your policy and procedure and read it for that particular organization. Have an applicable OSHA mandated safety program, and that's required by federal law. You have to have an OSHA program. Make sure personal protective equipment, PPE, is used effectively. You have to make sure that you are washing your hands, that you are wearing the right equipment when you go into isolation rooms. And I can tell you right now that if you are in an environment where you are not following the rules and you're not following OSHA and you're not wearing the right PPE, you are in violation. And I've seen people that have isolation, they got isolation protocol on their door, and people walk right in and never put on the isolation PPE equipment. And that is wrong, and you're not supposed to do that. And I see people do it all the time to this day. Ensure that appropriate housekeeping is properly maintained. Confirm that facility has disaster plans for internal and external emergencies. Analyze the workplace injuries and the illness data. It has to, they don't just report it, it is analyzed. That root cause analysis, what caused it. Promote performance of safety. Be the person that sets the example on your unit. Show people that you know how to do it right. I have had students over the years tell me, Dr. Locklear, you are very meticulous and very particular. Yes, I am, because I'm doing it the right way, and I'm going to teach you the right way to do it as well. You have to be meticulous and you have to be particular when you are providing care, because you could get in a lot of trouble if you make a mistake that you could have avoided and that you didn't follow the guidelines. Provide safety and health training for all employees at least annually, and we have to go to annual training. Nurses should encourage patients to actively speak up, ask questions about their medicines, and you need to tell them what medicines that you're giving them. So you, the nurse, have to know the medicines. They may ask you questions about tests and procedures. Now remember, we can't give any results of their test, but we can tell them what kind of test it is. We can tell them when they're going, what we have to do, if they've got to be NPO or drink, a contrast or take some medicine. But we cannot tell them, why they're getting it. You can't say, well, the doctor suspects you have cancer. You can't say that, okay? If they need that information, then the physician needs to be called and talk to them. Be knowledgeable about their condition or illness, how to prevent complications, how support persons to assist in these areas. Be vigilant about safety of care. Be mindful of it. Make sure that you are aware that you are practicing safe. Practice safety behavior such as good hand hygiene. Foam in, foam out before you go out of the rooms. Wash your hands. Ask for help when you need it. There's nothing wrong for asking for help. That is being safe. Eating appropriate foods on prescribed lists. What if you have allergies to foods or things, or this patient's on a specific diet? Report any noted mistakes to the nurse or another staff member. You have to report. Don't be scared to report. They will back you up. They will help you, but you do need to report when you make a mistake. Employees need to be competent in and use a range of safety skills. We use 2 identifiers to check our patients. We do the 7 rights of MedPass. We make sure the beds are low locked, the call lights are in place, the rooms are clean. Be able to identify safety hazards in your area. Take responsibility for correcting them. If you walk in and the call light's on the floor, pick it up and put it on the bed. I was in clinical the other day, and the patient had been gotten up in the chair, and the call light was hanging over the IV pole, but the patient still couldn't reach it. So I had the student, which the student didn't do this, but me and the student corrected it. We unlocked the chair, moved it closer to the bed, locked the chair back, and then the patient was able to reach the call light. If a survey team would have walked in and saw that, the hospital would have been decided for a deficiency. So those kinds of things. So what are alterations to safety? Incomplete assessments, skipping a step during a procedure, cutting corners. Don't cut corners. Even unintentional mistakes can result in longer hospital stays because of infections and falls and injuries, accidents, functional decline, even death. Catastrophic adverse effects may serve as motivators for prevention, but it might be too late to motivate you, because at that point you may have lost your job and you can't practice anymore. Be very careful about what you are doing. It just pays to pay attention. Safety initiatives, campaign zero advocates for patient safety by providing checklists to patients. Do your checklist. Have you met the things on the checklist? Families to use when admitted to the healthcare facility. Have we done these things? Items support patient safety, the quality of care. Help prevent never events. Never events, which are preventable hazards that can result in injury or death and that should never happen. A checklist may be given. Think about the patient that's in surgery and they're supposed to have the left leg operated on, but they operate on the right leg. Okay, and so a mistake has been made. Those checks and balances were not done correctly. Think about sound-alike, look-alike medicines, and you ignored the warning signs on your Omnicell or your Pyxis, and you gave hydralazine when you were supposed to give hydroxyzine. Two different drugs, two different effects. What to do to avoid complications, how to notice something is wrong. That's when you're doing your assessments, and that's that critical thinking and clinical judgment. You listen to what the patient says. Look at them. Look at their skin color. Look at their breathing. Listen to their complaints. Are they alert and oriented? Can you wake them up? Can you not wake them up? Look at their labs. Look at their vital signs. How to talk to a physician. When you talk to a physician, you address them by their name, Dr. So-and-so, and you say, I'm calling about patient in room such and such. They're 68 years old, female. She had gallbladder surgery yesterday, and here's what's going on with the patient today. The patient is allergic to those kinds of things. When to notify the nurse, how to ask appropriate questions. So, no question asked is a dumb question, okay? Other safety initiatives, one needle, one syringe at a time. Initiative of Centers for Disease Control and Prevention, the CDC, and Safe Injection Practice Coalition. So, you can't do but one thing at a time. And you see in the picture here, it's got a safety cover over it. So as soon as you give it and pull it out, you cover that needle so you don't stick yourself or stick the patient by mistake. Healthcare facilities can use three-pronged approach to quality and safety. Organizations support for keeping quality and a safety priority. Promote a culture of safety. Be the role model. Healthcare employees consistently choosing to follow health safety rules and standards in the environment, in patient care, and safety advocate. Advocate for others. Use your critical thinking skills and your clinical judgment and speak up. Say, hey, this is what I assessed on this patient. I don't feel good about it. Something's just not right about this patient. Encourage patients to be actively engaged in every aspect of their care. Encourage them to tell you when they feel that something's not right. On page 2875, you have concepts related to safety, and we're accountable. We should be an advocate. Our assessments, clinical decision, evidence-based practice, and quality improvement. We're going to go over these in class in the lecture too, but read through these like accountability, unsafe nursing practice, behaviors and thinking could cause harm to patients and others, and if not addressed, will continue to occur. So what's the nursing implications? Unsafe nursing practice should be reported and addressed. If you see one of your coworkers doing something unsafe, for example, every time they go in the room, they don't put on their PPE equipment for the isolation patient, you need to report that. You're not snitching on your coworker, you're protecting your patient. And we are ethically bound by our Board of Nursing and our licensure to advocate for our patients and speak on their behalf. So make sure that you read over 2875. Health promotion on page 2876. You have some health promotion practices. Be physically active at any age. Use protection against injuries and accidents. Motor vehicle safety. Smoke free. Maintain a healthy weight. Monitor your health. Get enough sleep. Because here's the thing. If I don't take care of me, Can I take care of a sick patient? And the answer is no. If I go to work and I'm sick, I should have stayed at home. If I go to work and I've been up all night, I'm not going to be safe for that patient. That's just like you as students. You should go to bed by midnight. I don't want you up studying all night at a healthcare facility at 6:30 in the morning ready to take care of patients. You're not safe. And as you see, I got a little picture here, 12 tips to be healthy. I know you can't read it that well, but eat a healthy diet. Get vaccinated. Boy, we know that's a big concern right now, vaccinations. Nursing assessment. So how does nursing assessment, the nursing process, play into this? It includes specific age-appropriate questions, observations focused on safety needs. You know, ask the question. It gives you some examples. If the patient is asked, have you ever noticed blood in your stool? The patient responds, yes. The nurse should then explore. If the patient responds yes sometimes to the questions, then you need to ask an open-ended question. Well, tell me more about that. Have you ever thought about hurting yourself? If they say yes, say, tell me more about that. Healthcare facilities have own safety checklists based on recommendations of organizations such as the Joint Commission and the CMS. Risk-based assessment data help to identify patients who may require special precautions. Maybe this patient has an infection. They need to be on isolation. That data helps us identify that. It can be divided into levels based on patient response. Are they low risk, medium risk, or high risk? And some of the risk assessments, look on page 2875. Common safety risk assessment data from the patient or family during the interview. So when you're doing your assessment, you're also interviewing the patient as well. Can they communicate? Can they provide self-care? What is their cognitive status? That should be the first thing you assess when you go in to do your head-to-toe assessment. What is their cognitive ability? Bowel and bladder, susceptible to falls. Do we follow the bed rail policy? You know, what does our policy say about bed rails? Visual or other sensory deficits. Please put their glasses on and help them with their hearing aids. If any of you wear glasses, you know what I'm talking about. It's the first thing I do when I get up is put my glasses on because I can't see without them. And our patients are the same way. And clean their glasses. Please don't put dirty glasses on your patients. Make sure their batteries are working in their hearing aids. Mobility devices. Do they use a walker? Do they have good fitting shoes? What's their skin integrity? Do they have tubes? There's tubes here listed for you. They didn't list chest tubes. The tube of a chest tube actually comes out of the chest. It goes down the side of the bed, and some of it's on the floor connected to the drainage system. You have to be extremely careful not to step on that tubing because you'll pull it out of their chest. And, you know, just monitor their nutritional status, developmental considerations, and are they vulnerable to injuries. Teaching patients protective measures to reduce their vulnerability for safety issues in a healthcare facility, home setting, or community setting helps the patients engage in their nursing plan of care. They should be a part of that plan of care. Look at page 2877, and it talks about patient teaching, and it gives you 10 questions that you should ask and at least examine. Then during the physical exam, we constantly observe and we monitor for changes in condition. We want to look at their cognitive changes. Has their level of consciousness changed? I'll give you an example. The drug digoxin is a cardiac drug. It helps slow the heart rate down, but it strengthens the beat of the heart rate. Well, you can get toxic from taking digoxin. Some of the classic symptoms of dig toxicity is nausea and vomiting, change in mental status. But that also are the same symptoms of a UTI, especially in an older adult. So you need to look at their med list and say, hey, what kind of meds are they on? Because some of their meds be causing this. Physical changes, changes in vital signs, oxygen saturations, is it too low? Is their skin color abnormal? Changes in how an incision looks, or diaphoresis. Do we need to check their blood sugar, or do they have a fever that causes diaphoresis? Seizures can cause diaphoresis. Onset of pain, functional changes, slurred speech, change in mental status, weakness of an extremity, behavioral changes. Are they hallucinating? Oh, I see something on the wall over there. You need to be aware of that. Changes in sputum color from clear to yellow, water to tenacious amounts, copious, will influence the quality and safety of the patient's airway. Do they need to clear their airway? Are they drooling from their mouth? Do they just not know where they are? Does their urine smell bad? Do they complain of weakness and fatigue? Do we need to get a hemoglobin and hematocrit on them? Standard precautions, hand washing and using PPE, personal protective equipment, safe injection practices. You know, try to use those needles that you don't have to recap. And effectively managing contaminated waste. Put it where it needs to go and handle it appropriately. Latex allergies. Is the patient allergic? You need to look at their allergies. If they are, you need to wear non-latex gloves. Wash your hands off after taking off the gloves. Make sure the patient is assessed after they've been touched with someone that's got gloves on. You should use the non-hypoallergenic gloves that are latex free and powderless. General exposure to chemicals. How do we handle that? What are we looking at? You know, respiratory problems. Are they having difficulty breathing? On page 2879, you have safety initiatives from the AHRQ, the CDC, the Institute of Medicine, the Joint Commission, the National Institute for Occupational Safety and Health, OSHA, and CUSAN's my favorite, and the WHO. Please read over that on page 2879. Our collaborative efforts, we have international, federal, state organizations, community initiatives, these are incorporated throughout the state. Safety culture, this is a general feeling of shared attitudes, values, practices, beliefs that result in behaviors and feelings of responsibility for safety in all daily routines. Organizations and employees working together can build and maintain blame-free environments. Focus on systems, not the individuals. Now, this is organizational, okay? Everyone should be involved, everyone. So what do we do with these collaborative efforts? To support safety initiatives, healthcare facilities can do the following. You want to promote a safety culture, a culture of safety. You got to work together to make sure, everybody should make sure that there's not trash on the floor. Pick up the call lights, straighten up the rooms. It's everybody's job to do that. Make necessary resources available. Include all levels of employees in committees making decisions about initiatives. Celebrate improvements. It's always nice to tell people they did a good job. Do management walkthroughs, and good managers will do that. They'll be out on their units every day. Offer periodic safety training. Share successes and improve patient outcomes. You want to look at support surveys. Improve job satisfaction. Why am I not happy with my job when it comes to what we're doing about safety? Quality and safety education for nurses, CUSAN. Look on page 2880, table 15-3. Patient-centered, quality improvement, evidence-based practice, teamwork and collaboration, informatics and safety. These are the seven pillars of CUSAN, which means quality safety education for nurses, to better prepare nursing students with practical experiences in providing safer, more effective care. And again, here are the competencies, and they give you a definition of the competencies on page 2880. Make sure you read over those. We'll talk about those in class. And here's a little diagram that I added in for the QSUN for you so you could see it again. Student-centered learning. It's the quality, safety, education of nurses. So we want to make sure that we are providing what you need in the nursing programs, and when you get out in practice, that you're still getting training and practice, because you're not going to know everything that you need to know when you get out into practice. Another thing that is so important, and I'm going to have a whole presentation on the National Patient Safety Goals when we have this part in our course. The National Patient Safety Goals. These are goals to help accredited organizations deal with specific topics on patient safety. It's developed and revised by patient safety advisory groups, panels of nurses, physicians, pharmacists, risk managers, so forth. They all get together and they analyze safety concerns and evaluate which have maximum impact and which need to be changed. It is updated annually, and each goal accompanied by elements of performance identified by the Joint Commission are necessary to meet the goal. And so when I show you the presentation on the National Patient Safety Goals, you're going to see that they have safety goals for multiple categories of specific groups of patients and specific items that we deal with. It's not just one national patient safety goal. They have national patient safety goals for multiple things, and I'll show you those when we do that PowerPoint.